Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to use oatmeal baths for diaper rash relief. An oatmeal bath is a popular natural remedy for diaper rash. Oats contain skin healing properties that may treat diaper rash, eczema, and dry skin. /r/n/r/n Diaper rash is a common skin condition in babies. A diaper rash may cause redness or other changes in skin color, swelling, itching, and pain in the diaper area. Common causes of diaper rash include moisture, irritants, yeast infections, bacterial infections, and allergies. /r/n/r/nWillie B. Thomas, Getty Images /r/n/r/n An oatmeal bath involves mixing crushed or ground oats into your baby's bath water. It's okay to use any type of oats, including instant or quick oats. /r/n/r/n The most common type of oat used for skin ailments is colloidal oatmeal. This type of oatmeal comes in the form of a very fine powder. It can dissolve into liquid and is often added to skincare products. Colloidal oatmeal can coat the skin and protect it from irritation. /r/n/r/n Oatmeal is a proven treatment for dry and irritated skin. However, because most oatmeal studies have involved adults instead of infants, talk with your child's healthcare provider, such as a pediatrician, before trying a new natural treatment. /r/n/r/n One 2014 study found that skin creams that contained oatmeal were more effective than those without oatmeal. People who used oatmeal skin creams reported less dry and cracked skin than those who did not. /r/n/r/n Colloidal oatmeal is also an effective treatment for eczema. Adults who use colloidal oatmeal products experience fewer and less severe eczema symptoms. Colloidal oatmeal creates a barrier on the skin to help protect it from irritants and seal in moisture. This type of oatmeal has anti-inflammatory properties to reduce redness or discoloration, swelling, and itching. /r/n/r/n Preparing an oatmeal bath at home is simple and quick. Start by gathering your ingredients. You will need colloidal oatmeal or any oats that have been ground to a fine powder. If using colloidal oatmeal, opt for products that do not contain any additives or fragrances. /r/n/r/n If preparing your own oats, drop a spoonful of oat powder into a glass of warm water. If the oats dissolve in the liquid, they are ready for a bath. /r/n/r/n Fill your sink or small baby tub with warm water, checking the temperature to make sure it is not too hot. /r/n/r/n The American Academy of Pediatrics, AAP, recommends using an infant tub manufactured on or after October 2, 2017, to ensure that it meets current safety standards. The OP does not recommend using a bath seat that fits into a larger bathtub because it can easily tip over. /r/n/r/n As the water runs, slowly add your oat powder, about a teaspoon at a time. This will ensure the oats dissolve into the water rather than clump together. You may need up to 1 cup of colloidal oatmeal for a bath. /r/n/r/n Continue adding oats to the bath until the water appears milky white. Make sure you have all the supplies you need, such as mild baby soap, a washcloth, and your little one's favorite bath toys. /r/n/r/n Once the bath is ready for your baby, make sure that you have all of your supplies within arm's reach. Never leave a baby unattended in the bath. Use the inside of your wrist to test the water temperature. /r/n/r/n Gently place your little one into the bath and use your hand or a clean cup to pour water over their skin. Limit bath time to 10 to 15 minutes. /r/n/r/n After the bath, remove your baby from the water and pat their skin dry. Avoid rubbing your baby with a towel, as this can irritate their skin. Once dry, gently rub a baby moisturizer on their skin. Ask your pediatrician how often to repeat oatmeal baths, depending on your baby's diaper rash and skin type. /r/n/r/n An oatmeal bath may be right for your child if they have mild diaper rash and do not have an allergy to oats. Fortunately, reactions to oatmeal products are rare. Your child may not tolerate an oatmeal bath if they are allergic or sensitive to oats. /r/n/r/n While diaper rash is common, it can become serious. If your little one experiences frequent diaper rashes or one that never heals, see your child's healthcare provider. Some diaper rashes can lead to fungal or bacterial infections that require treatment with an antifungal or antibiotic medication. /r/n/r/n To lower your child's risk of diaper rash, change their diaper frequently, keep their skin clean and dry, and use a barrier cream if needed. /r/n/r/n Barrier diaper creams can help heal mild rashes. If your baby's diaper rash does not improve or worsens after a few days, you may need to see your pediatrician. /r/n/r/n An oatmeal bath is an effective natural remedy for diaper rash. Colloidal oatmeal is soothing and healing for diaper rash, eczema, and dry skin. Its anti-inflammatory effects help with the redness or discoloration, swelling, and itching caused by diaper rash. /r/n/r/n To prepare an oatmeal bath, mix colloidal oatmeal into warm bath water until the water looks milky white. Place your baby in the bath for up to 10 to 15 minutes, never leaving them. Then, pat your little one dry with a soft towel and apply a gentle moisturizer. /r/n/r/n Talk with your child's pediatrician if they continue to experience chronic diaper rashes or any rash that doesn't go away. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.